Hello, I'm Dr. X. Today, we're demystifying a topic that's often misunderstood or overlooked: vitamin B6 toxicity. While vitamin B6, pyridoxine, is essential for brain function, energy metabolism, neurotransmitter production, and immune support, excessive intake, almost always from supplements, can lead to serious nerve damage. Many people assume more is better with water-soluble vitamins, but B6 proves that's not always true. In fact, chronic high doses can cause peripheral neuropathy that mimics deficiency symptoms, and recovery can be slow or incomplete. In this video, we'll explore this progressively, first with simple logic and relatable examples for everyday understanding, second, through physiological mechanisms and real-world behavioral patterns, and finally, with scientific theories, clinical data, and precise terminology. Whether you're taking supplements for energy, PMS, or carpal tunnel, or just curious about nutrition, this will help you navigate safe use. Let's start simple, with everyday logic and examples. Imagine your body as a busy kitchen where vitamin B6 is one of the key assistants. It helps stir the soup, metabolize proteins, turn on the oven, make energy from carbs, and keep the fridge cold, support nerve signals. You need this helper in just the right amount to keep everything running smoothly. But if you suddenly hire 50 extra assistants for the same job, they crowd the space, bump into each other, spill ingredients, and start breaking things, like the electrical wires, your nerves, that carry messages from your brain to your toes. That's what happens with too much B6. Instead of helping, excess pyridoxine overloads the system and damages sensory nerves. You might first notice tingling or pins and needles in your feet or hands, like when your foot falls asleep. But it doesn't go away. Over time, it can feel like burning, numbness, or even difficulty walking, as if the wires are frayed or short-circuiting. Logically, food sources are safe: bananas, chicken, potatoes, chickpeas, and fortified cereals provide 1 to 2 milligrams per day, plenty for most people, with no toxicity risk because the body regulates it naturally. Supplements are different. People often take 50 to 500 milligrams, or more, thinking it'll boost mood, reduce fatigue, or treat conditions like PMS or carpal tunnel. But chronic doses above safe levels accumulate, even though B6 is water-soluble. Example: a patient starts 200 milligrams daily for energy, feels great at first, then months later develops numbness in their feet, loses balance, and struggles with stairs. Blood tests show sky-high B6 levels. Stopping the supplement is the fix, but symptoms can linger for months or years. Key takeaway here: moderation is everything. Food gives what you need without overload, supplements require caution. Stick to recommended doses unless a doctor supervises. Now, let's deepen this with physiology and behavior. Physiologically, vitamin B6 exists in forms like pyridoxine, common in supplements, pyridoxal, and pyridoxamine, converting to the active coenzyme pyridoxal 5-phosphate, PLP. It's crucial for over 100 reactions: transamination, amino acid metabolism, decarboxylation, neurotransmitter synthesis like serotonin and GABA, and glycogen breakdown. At normal levels, it supports nerve health; at excess, it paradoxically harms them. The main issue is peripheral sensory neuropathy. Excess pyridoxine saturates conversion enzymes, pyridoxal kinase and oxidase, leading to unmetabolized pyridoxine buildup in plasma and tissues. This preferentially injures sensory neurons in dorsal root ganglia, causing axonal damage. Symptoms start distally: glove and stocking pattern, tingling, burning, numbness in hands/feet, then proprioceptive loss, poor balance, ataxia, and sometimes muscle weakness or fasciculations. Motor nerves and central nervous system are usually spared. Behaviorally, toxicity sneaks up. People take high doses long-term for self-perceived benefits: energy, mood, PMS, carpal tunnel, often from multivitamins, energy drinks, or targeted supplements. Many don't realize B6 adds up across products. Risk rises with duration. symptoms can appear after months to years. Vulnerable groups include those with genetic variations in metabolism enzymes or on meds like isoniazid, which depletes B6, leading to ironic high-dose overuse. Real-world pattern: a middle-aged patient takes 100 to 200 mg daily for nerve health, ignores mild tingling as aging continues, then presents with severe imbalance and elevated serum B6. Cessation helps most recover partially, but some have lasting deficits. Physiologically, it's dose and time dependent. Behaviorally, education and label checks prevent it. Many countries now require warnings on greater than 10 mg products. When it comes to scientific theories, clinical data, and terminology, vitamin B6 is a classic case of too much of a good thing. At the right dose, about 1.3 to 1.7 mg a day for adults, it's essential for energy, brain chemistry, and metabolism. But toxicity follows what we call a non-monotonic dose-response curve. It's helpful at low levels, harmful at high supplemental levels. The main culprit is pyridoxine, the common form found in supplements. When taken in excess, it overwhelms the body's enzymes and builds up unmetabolized. This can interfere with nerve signaling, especially GABA, which helps calm the nervous system. It may also disturb calcium balance, stress mitochondria, or create reactive byproducts. The critical effect is sensory peripheral neuropathy. That means damage to the long sensory nerves. People develop tingling, burning, or numbness in their hands and feet, lose balance, and struggle with coordination. On nerve tests, we see axonal sensory loss. Thresholds vary. Some case reports show symptoms at chronic intakes as low as 50 to 200 mg a day, depending on genetics. Severe cases usually involve doses above 500 to 1000 mg daily. Importantly, food sources don't cause toxicity. The average U.S. intake is only about 1.9 mg a day, well within the safe range. Let's talk about how different health authorities view safe limits for vitamin B6. In the U.S., the NIH sets the upper limit for adults at 100 mg per day. That's based on studies showing no nerve damage below 200 mg. But Europe's EFSA recently took a more cautious stance. In 2023, they lowered the safe level to just 12 mg per day, using a reference point of 50 mg and applying a safety factor of 4. Because the risk increases over time, even at lower doses, and the data isn't perfect. Australia's TGA goes even further. They require warning labels on any product with more than 10 mg of B6. So how do we diagnose toxicity? It's mostly clinical, meaning we look at symptoms like tingling, numbness, or burning in the hands and feet. Blood tests help too. We measure pyridoxine and its active form, PLP. Normal levels range from about 20 to 125 nanomoles per liter. Toxicity often shows up when levels exceed 200 to 400 or more. Treatment is straightforward but slow. First, stop the supplement immediately. Recovery can take months, or even years, and some people don't fully recover. Supportive care like physical therapy and pain management may help along the way. In summary, vitamin B6 is vital, but toxicity from supplements is real, dose-dependent, and primarily causes sensory neuropathy through neuronal overload. Food sources are safe, avoid megadoses, greater than 50 to 100 mg per day unsupervised. If tingling, numbness, or balance issues arise, stop supplements, get serum B6 checked, and consult a doctor. Prevention beats reversal. Thanks for watching. Drop questions below. Stay balanced, stay informed. I'm Dr. X, see you next time.